Oh, come in.
Hi, my name is Michaelin. I am a registered nursing student at Northwestern State University. I'm going to be part of your healthcare team today. Is that okay?
Yeah.
Alright, so what we're going to start with is we're going to start with physical assessment. First, I'm going to identify that I'm in the right room.
Okay.
Can you tell me your name, please?
Victoria Burnley,
And your date of birth?
11/02/03.
Alright, perfect. And then set you up just a little bit. Privacy has been provided for the patient and vital signs have been obtained. Alright, so I'm going to put this down so we can get a little bit closer. Alright, so can you tell me where you're at today?
And as you
Alright, and do you know what the date is?
Wednesday,
Alright, and then what brought you here today?
pain in my abdomen.
Alright, okay, so about your pain in your abdomen, what caused that? Was there something that happened or?
No, I just woke up with it one day.
Okay, and then can you show me the location of it?
Right there.
Alright, right there. And then how long has this been going on?
About 2 days.
Okay, 2 days. And then can you explain to me how the pain feels? What does it feel like? Is it sharp, dull?
Sharp.
Sharp pain. Alright, and then is there anything that you do that aggravates it, makes it feel worse?
Lay flat.
Laying flat.
Yeah.
Okay. And then is it just in one area or does it radiate to another piece?
No, it just stays right there.
Stays right there. Okay. And then what are you doing at home to make it feel better?
Just taking some Tylenol.
Tylenol. Okay. And then I'm gonna get you to rate it on a scale of 1 to 10. 1 being not too bad and 10 being the worst pain you've ever felt. What would you rate it?
Probably a 4.
A 4. All right. Okay. And how did you sleep last night?
Pretty good.
Good. And then how's your appetite? Did you eat your breakfast? You did? Okay. So what we're going to start with is I'm going to start with assessing your eyes.
Okay.
Just a couple things I'm going to need your help with. The first thing I'm going to get you to do is I'm going to get you to tell me how many fingers I have up. 2. Okay. And then for this next one, just kind of look over there for me. I'm going to shine this light in your eye. All right.
Well, you said in the back there was even in
All right, and then so for the next thing I'm gonna need you to do for me is look at that IV pump over there, and I'm going to put this right here, and can you look at my pen for me? Perfect. All right, the next thing I'm gonna do is I'm gonna assess the cardinal fields of gaze. So what I'm gonna need you to do is just keep your head straight for me, just move your eyes with the pen, okay? Perfect. All right. So with your eye exam, I assessed Perla. Your pupils are equal, round, reactive to light and accommodation. Okay. All right. So moving on from that, we're gonna do your oral exam. So have you had any issues with swallowing? No pain, no nothing? All right. So alright, and then just because I forgot, I'm going to state that the patient is alert and orient times 4. And then she hasn't asked me to repeat anything, so I know she can hear me. So now we're going to do your oral exam. So the first thing I'm going to do is if you could just open your mouth and say "ah" for me. Alright. Your mucous membranes are pink and moist, your tongue is pink and moist, and your uvula moves as it should. And then your lips are pink, moist, no lesions. That's good. The next thing I'm going to get you to do is I'm going to test your gag reflex. So if you just open your mouth, stick your tongue out. Perfect. Your gag reflex is active, and that's good. And then the next thing I'm going to get you to do is just stick your tongue out and then move it side to side. Perfect. Making sure it doesn't deviate to one side, and it doesn't. All right. And then Next thing I'm gonna do is I'm gonna test your facial nerve functions. So if you can you give me a really big smile, please? And then puff out your cheeks, clench your teeth. All right, and then raise your eyebrows for me. Okay, so everything is symmetric. You're good. It all works. Next thing I'm gonna get you to do is push your shoulders up with my resistance. Push on one side of your face with resistance, and the other side. All right, and then while I'm thinking about it, before I forget, can you squeeze both of my fingers for equal strength? Perfect. All right. So that is your nerve functions, and everything is good with your facials. Next thing I'm gonna do is I'm gonna check your respiratory. I'm gonna do a respiratory assessment on you. Okay. So what I'm gonna get you to do is I'm just gonna sit you up just a little bit. Is that comfortable?
Mhm.
That's good. All right. So what I'm gonna need you to do for me is just take a couple deep breaths for me, and I'm just gonna be listening to your lungs.
Yeah, see, like when I come through, I just go ahead and ask all those little questions. Like, have you been throat swallowing? Your mucous membranes are moist and wet. Your uvula
All right. And then if you could just sit up if you can for me, and then listen on your back. And then what I need you to do here is if you could just give yourself a really, really big hug and put your chin to your chest. Perfect.
Apply force inside of your head. You just have to go against that force. Now I want you to be on your shoulders. Thank you. Your strength, let's see, final force side. Now I'm going to move on
Perfect. All right. And all of your breaths are even and unlabored. I can tell just by looking at you that they are all equal. Your respirations and your inspirations are equal and unlabored. All right. So that's your respiratory assessment. The next thing we're going to do is I'm going to do a cardiac assessment on you. Doesn't need much help. Just relax for me. All right. So we're going to listen to the aortic valve, pulmonic valve, Erb's point, tricuspid, and mitral. All right. And so S1 and S2 valves are heard distinctively. That's good. And your rate is regular, and your rhythm is normal, or regular. I'm sorry. All right. So the next thing we're gonna do is I'm gonna do a abdominal assessment on you. All right, so I'm gonna get you to lay down. And then can you tell me when, are you having any issues with urination or bowel movements? All right, and what was your last one?
Yesterday.
Yesterday, okay. And then just to make sure your pain was on this side. All right. Lift your knees up a little bit. All right. You comfortable?
Mhm.
As comfortable as you can get? All right. So first I'm going to do is I'm going to inspect the abdomen. I'm going to be looking for moisture, feel for the temperature, edema, lesions, anything on there, which everything looks normal. First thing I'm going to do is I'm going to auscultate and listen for your bowel sounds. All right. So I'm going to start in the right lower quadrant, left upper quadrant, left. If I missed that, if I said that wrong, right upper quadrant, left upper quadrant, and left lower quadrant. Okay. And so your bowel sounds are active. I should expect to hear about 5 to 35 in a minute. The next thing I'm going to do is I'm going to percuss. So I'm going to do it in the same order I just did it. And I'm just going to listen for tympani. Perfect. And then now I'm going to palpate, and so I'm just going to be feeling for masses. And so since you have pain on this side, correct, I'm going to save that one for last. So I'm going to palpate, and this is the right upper, left lower, and then gently palpate where that pain is in the right lower quadrant. Okay? All right. Let me breathe. All right. I'm going to set you up just a little bit, and we're going to look at your extremities. Okay? Is that comfortable? A little bit more? A little bit more? That comfortable? Alright, I'm going to put your knees down. Lift your bed up a little bit. I think I got shorter already. Alright, so the first thing I'm going to start with is I'm going to be looking at your arms, make sure they're the same length, and then I'm going to feel for your temperature, your moisture, edema, and then I'm gonna feel for turgor. All right, and then I'm gonna do capillary refill, and I'm gonna go ahead and do it on both hands, and it is less than 3 seconds. I'm going to feel for your radial pulses. All right, and they are equal bilaterally, regular strength and rhythm and rate, so that's good. And then I'm going to move on to your lower extremities. So I'm going to feel your legs for their temperature, moistness, texture. I'm going to check for edema, check for turgor. And then also within the whole body, I'm going to be checking to make sure that the skin color is the same all throughout. And then I come down to your feet, and I'm going to do capillary refill, which should be less than 3 seconds. I'm going to check your dorsal flexion. So if you could push up on my hands for me. I'm going to check your plantar flexion. If you could push down for me, perfect. And then now I'm going to find your dorsalis pedis pulse.
So just go against my force.
All right. And then those are bilaterally equal and regular rate and strength. All right. Make sure I didn't forget anything. All right, and so now I'm gonna get you to roll over towards me. I'm gonna grab your arm and then help you over here. Please don't fall off the bed. I'm gonna check for the neck, the coccyx, the heel, and her head. Everything is the same color. Temperature is good, no edema. We're good. And you can roll back over. All right, and so what we're gonna do now is I'm just gonna lower you back down. Are you in the comfortable position?
Mm-hmm.
All right, so I'm gonna lower your bed just for safety. If I just fail. Is there anything you need of me right now? No? Okay. And here's your call bell. If you need me, just call me in here. I'm gonna check for any possible IVs, anything attached to you, tubes, anything. Everything's normal. You don't have anything. What would you rate your pain as of now? On a 4. So okay. All right. You're in a comfortable position. You're good. You don't need to use the restroom. Nothing. You're good. All right. So I will be back in here in about 30 minutes. And if you need anything, just call us. Thank you.
And then he didn't say the cardinal.